Good morning. By a quick show of hands, out of curiosity, how many providers in the room have ever struggled, had difficulty finding mental health care for any of their people living with ALS or their caregivers? Yep. That remains and consistently remains to be one of the biggest issues that we have in our ALS community, is not only accessing care, but making sure that our mental health providers have information about the disease experience, and about the experience of the family and caregivers. Hold, please. Can I get my little cheat video here? Because I can't really see the screen. Everybody talk amongst yourselves for a second. So anyway, all right, well, I'll just move forward. First of all, I'm going to go back a second because I want to be really clear that I am up here presenting this, but I am by no means the person who did it. And this is a really fantastic collaboration between myself, Mental Health America in Montgomery, Alabama, and the ALS Association. So it's a true partnership with community organization, disease organization, and research. And I'm incredibly proud to be a part of it. So that's not there, but I'm just gonna keep looking sideways. Now this isn't working. Like, okay. Well, I know what I'm going to say anyway. So we did a program that was informed by, oh, here we go. Is this one not working? I don't know. Did you do that on purpose? Good morning. So this quote was by someone living with ALS in one of the support groups in Alabama. And I think that well encapsulates the experience of people living with ALS, that if they have to spend too much time and energy telling their therapist about what ALS is, what the experience is, then it often kind of negates I'm not touching anything. Do I get extra time? Okay. You know, I'm kind of tired. I don't know if I drank enough coffee to be able to just riff. Does this work? Oh, yeah, okay. I can look up here. That's okay if that doesn't work. Okay. So thank you to MT Pharma America for supporting this program. This is the slide I was on. So it takes too much energy to have to explain ALS to a therapist. We know that mental health provision, mental health services, myself being a licensed clinical social worker, that value of it is critical, but we also know, A, we don't have enough mental health providers, and two, we know that we don't have enough trained mental health providers to really be able to have those deep conversations. So as I was saying earlier, this is a partnership, and through multiple professional meetings and sitting down with people living with ALS in a support group in Alabama and just saying, what is it that you would like a therapist to be able to know in order to support you? What kinds of resources do you need from a mental health therapist that they need to be trained in providing you, right? So through all of these interviews, we decided to come up with the ALS Mental Health Referral Network. And what we hope to be able to do with this is expand well beyond the United States, well into global reach, to really be able to educate those mental health providers in what the process of ALS is and how ALS is impacting the family, right? So the goals of the program were to do a couple of different webinars. We wanted to do one first to see like what kind of content is important, who will attend, and who will be providing that content. And the goals of the initial webinar were really thinking about supporting people with ALS, understanding grief and loss in ALS, not just with the person living with ALS, but with their family members as well. And the impact of the family, the caregiver perspective, including those children and youth. I can't say how many times over the years I've been approached, because of the work I do with children and youth, by individuals, by family members saying, do you know a therapist who understands the children's experience in ALS? And it's a shame because I don't know enough to be able to pass out information to all the people that ask me. So we got together a group of healthcare professionals, chaplains, social work, folks who work in the ALS Association, Melissa Enfinger, to deliver the first webinar and just get a sense of what might work and what might be we need to add to it. So after the first one, we realized, hey, we think we have something coming here. So the second session we did just recently, earlier in 2024, and we used the same format. So it was a webinar. It had an introduction to ALS, overview, what the disease is, and then we had multiple speakers, again, presenting about this is how people talk about their experience with ALS, both as a person living with it and their family caregiver. And here are resources. So therapist, whoever you are, licensed clinical social worker, LMFT, here are resources that you can then pass on to the person that you're working with. And the people who attended the second webinar, we had quite a few social workers. We had licensed mental marriage and family therapists, we had psychology, we had nursing, and then we had a lot of clinical staff, some of whom already work with the ALS Association, but we also had clinical staff who are not affiliated at all with the ALS Association, but who were interested in being a part of this webinar so that they could help their mental health providers. So we had a really nice cross-section of folks who participated in that second webinar. We had 37 people complete the pre and 30 complete the post out of the 78 individuals who participated in the webinar. So I'm going to go through some of the results to really get a sense of what their thoughts were relating to how they can take this information into their own practice. And does it impact their confidence in working with people living with ALS and their family members? Because that's really critical. It's one thing to be able to attend a webinar and say, yeah, that's cool, but it's another thing to say, yeah, I think it really actually impacts me and my practice, and I feel more confident in accepting a referral from someone living with ALS, or I feel more confident engaging with an organization that serves families living with ALS. So one of the first questions we asked is that knowledge of ALS, did it change post participating in the webinar? And the majority of people felt yes, it did. And then we asked how. How did that change? What changed about it? And it was really nice because it helped them understand the connection between ALS and mental health. Now, we all get that. Right? We all get that in this room, but we're talking about people who have no knowledge of really what that connection may or may not be, and they're getting that, wait a minute, there's a very important mental health piece in dealing with and living with and providing care for ALS. They also felt a real shift in the impact on the family members, knowledge of resources, and really the ability to help develop new strategies for intervention. So as people living with ALS are referred to them, they felt that they could actually implement some of these new strategies. And are they going to use it in their future practice? Thankfully, yes. They really felt that they absolutely could use it in their future practice, that they wanted to be able to include a discussion of children and children's resources, that they wanted to develop new ways of working with ALS, and they also wanted to be able to make and engage in those resource referrals. Now, did it also make you more interested in working with people with ALS and their family members and their caregivers. We know that as mental health providers or as other providers, you often get bombarded with referrals. And sometimes it's like, oh, do I feel confident, but do I really feel genuinely interested and or excited in doing it? And they really did. They commented a lot on making sure that what they're doing integrated the family and the family perspective, that they wanted to talk more about couple and family therapy. They wanted to ensure that the person receives proper services, recognizing that gap, recognizing their education gap in what they do and don't know about ALS. And looking at the confidence, right? So do they feel as though they have increased their confidence in engaging with people living with ALS, with their family caregivers, but also do they have confidence in being able to accurately make resource referrals? Do they have that confidence in saying, I know opportunity X exists. I know organization Y exists. And we saw a significant change from pre to post in these areas of confidence, which is really spectacular because that's what seeks or gets our mental health providers across professions interested in reaching out and saying, yes, I want to connect with this ALS organization or that MND organization to provide these mental health services. So we are incredibly pleased at this very small pilot project. This is by no means the biggest data collection at all, but we are incredibly encouraged and feel very positive that something as simple as providing a webinar that includes information about the disease itself, the process by which families engage around the disease, the experience, the need for resources for family members, from people living with ALS to their children. We feel incredibly encouraged that the results really show that it did make a difference, and that there is that increase in confidence, and that we're providing that opportunity to make a change in their practice. Our next step, so we're about to send out a follow-up survey to see what happened next over time. Was this just a little bump because you did this really cool webinar and you feel good about it? Or does it really make a difference? Have you changed your practice in some way, shape, or form to be more inclusive to ALS, to people living with ALS, to their family caregivers? At the end of our survey, we asked them, okay, so we thought these were really cool topics. What do you think are important topics for a next webinar? And these were some of the topics, and they were absolutely fantastic. ALS and trauma. I mean, these are therapists who are saying, I need more information in this. And I feel like I'm having these conversations in other settings, but I know that it's going to be important in the ALS world. So ALS and trauma, caregiver stress and burnout. We talked about that yesterday. Absolutely critical. I would love to see more mental health providers really kind of strengthened in that area and willing and confident and engaged. Also co-occurring mental health disorders, further resources for caregivers, dealing with ALS and FTD, and finally, intimacy in ALS. And this came up multiple times and is so critical that we just get all weird and squeamish about it, but therapists do as well. But they want to be able to be comfortable and talk about, like, what is intimacy? What is sex? What does all of that look like with someone who is living with an illness like ALS? And then also really continuing to promote the network. We are incredibly proud of it. We are looking to do multiple new webinars, and we want more partners. We absolutely want more partners, because the goal is not to just train a subset. The goal is world domination, and it's about getting all the mental health providers out there engaged, yes, engaged, because we know how critical that mental health care is for all of our people in families with ALS. So that is the end. And thank you all for being so patient with all the weird. Did you give me extra time?
I gave you 1 minute.
Oh, nice. That's such a good friend. But that is it. I am really happy to take questions. I want to put the contact information up here. So that's me, but really Melissa Enfinger, who is online, who was unable to attend today, is spectacular. And she is a force to be reckoned with and really worked incredibly hard to put this together with the Mental Health America in Montgomery, Alabama. Now, if you're from the U.S., that's the southern part of the U.S. It's not exactly resource rich. So the fact that they engaged and really dove in is exciting. So thank you all very much.
Thank you, Melinda. Thank you, Melissa, wherever you are. I would just like to say that I think the intimacy in ALS, MND is something that in Australia I talk about a lot. You know, my two favorite ADLs, smoking and sex. So I'd be well up for adding an international flavour to anything that you're doing.
Yep.
So we've got a few minutes for questions over there.
Do you, in the mental health, there's such a different need when someone is first diagnosed, both on the PALS and the CALS side, and as you know, once someone's on a feeding tube, a respirator, and can't move, entirely different set of mental health problems, challenges in that area. Does it cover the whole gamut? And then the second part of that is anxiety seems to be part of the disease. At the beginning, people are not all that anxious, but as all of you know who have worked with a lot of PALS, you've got these strong, confident people that have never been anxious in their life, and part of this disease progression in some cases seems to be that massive increase in anxiety.
Excellent question. So for sure, the goal of the program isn't to say we want mental health providers engaged at only one point of the disease process. The goal is to say this is what happens with ALS over time, from prior to diagnosis, post-diagnosis. Absolutely. It's about understanding the continuum. What are some of the changes? What are some of the flexibility points throughout the process? So completely. And whether it's depression, anxiety, caregiver stress, whatever it is, those are all absolutely included in this program.
Thank you.
Probably have time for just one more question.
I've got one. And this actually kind of goes along with that. Mindy Erlob from End the Legacy. And I'm wondering, on the continuum in terms of ALS, there are people who are at genetic risk, and I'm wondering if this acknowledges us and if we're included in this in terms of mental health.
Absolutely, absolutely. One of the things that we recognize is that we've just done a small pilot. Right? This was first, will it work? Will people attend? Does it make a difference? And in that list, those were the things that the therapists suggested. But we also have our own suggestions as well. And living at genetic risk is 100% part of that. And, small plug to my partnership with ALS Canada in developing a whole program for children and youth, how to talk to children and youth about genetic risk. And we're going to be integrating that into this program as well for mental health providers to be able to have that information that, wait a minute, you might be talking with children, you might be talking with young adults, you might be talking with older adults who are at risk. Yes, it's an excellent question.
I think we have to wrap it up there, but thank you, Melinda.
You're welcome.
You're welcome.